Hello, all. This is Dr. Shilpi Reddy, and there is news that schools will reopen from 1st of September, and this is the state government decision to open all schools from 1st of September, and this has had a mixed response. And as a doctor, as a mother of three children, even I wanted to give my input into this. School is a place where there is overall development of the child happening. So it is not only about the emotional development, it's the social development also that is happening. There is so much of socializing that happens. Kids are now deprived of all these things, including their friends in school, and also so many other skills that come with socializing and emotional bonding. They have lost the contact with with their teachers, who are most of them play a role in influencing them. And if we have to talk about online classes, the curriculum and the syllabus and the methods of online classes have not been well scrutinized, and they still have limitations in access. And yes, limitations in access is there, and we are talking about millions of people, millions of children out there who have not had any access to online classes. And what about their growth and development? It is not only about their educational development, it is also about their nutritional development, wherein things come to a point that government schools, which were a source of breakfast and lunch, definitely had an impact on nutrition on the underprivileged children, wherein now because of the pandemic their nutrition status has even more gone down. And definitely this is a point to be noted. And the underprivileged children are not having access to online education, and their scope of going forward for education with modes of a phone or a television is definitely limited. And thinking about all these things, 1.5 year of academic loss is definitely important. And now that COVID cases have come down, and we are still having very few cases around in the community, maybe it's the right time to start away with the schools and taking utmost care. And yes, it is about strategies to help prevent COVID spread, and those strategies should be at multiple levels. Even when the children are getting transported, you should have strategies there to prevent spread during the transport, in the classes, wearing masks, social distancing, hand sanitization techniques. And also you have to take care that all the staff who's handling children, including the bus drivers and the class 4 employees, teachers, staff, administration, everybody is vaccinated completely. And yes, the news is there that an approval has been given for Zydus Cadila vaccine, Zircov-D, that is going to be available sometime next month. So the vaccination can also begin as soon as possible, as soon as the vaccine is in the market. But then before that, it is imperative that to look into all other safety aspects of preventing spread of COVID in the schools. And yes, a point definitely has to be noted that COVID can come back and the numbers can increase. So strategizing things is really important. Then a need comes when you have to stop schools and come back to an online mode of education. That also has to be there in place. And a newer ways of remote learning techniques have to be incorporated. And now children are still having complaints that their communication in when they are learning by remote learning methods is not that very good. And they are not having any support system to take care of their doubts and academic aspects also. And whenever there is possibility, then definitely remote learning has to be switched again when the numbers increase. But then as of now, millions of children are at home for past 1.5 year, and the overall growth and development has to be looked into. And now, since the cases are less, yes, we have to take utmost care in prevention and of transmission of COVID. And schools have to be tied up with healthcare facilities where they can be easily accessed to healthcare. taking care that anybody with symptoms has to be taken for testing and treatment, and also nutritional overlook over the children has to be there, and they have to be given nutritious food when they are in school. It's the government's job, and also that has to be monitored. And including all these things, health services of schools also have to be improved. That's really, really important. Sanitization techniques in the schools and health services of the schools have to be improved. And now there are so many complaints regarding psychological issues and psychiatric problems, and increased levels of depression in children that we are seeing because of closure of schools from past so many months. And yes, there are reported instances of increased child abuse also that has been happening, and they are underreported and not reported as of now. So it is very important that in the current given scenario, we have to start schools with safety and all protective mechanisms in place. And given a chance, you have to look into all these things. For a matter of fact, there is nothing called safe. And even in house, if you are exposed, people are getting COVID, especially when the parents are going in and out of the house, commuting and going for groceries, or even working from home or from office, they have to commute. There is a chance of infection spread to the children. So there is absolutely nothing called 100% safe for children if they stay home. It is all that you have to balance, and it is all that you have to know how to take care of the scenario and how to go forward. So it is our given point of time a decision to keep it as low as possible, the risk of spread of COVID, by taking care of vaccination of every person who is exposed to the children, and social distancing, hand sanitization techniques, and a proper mask to be worn by children. And they, as far as possible now, they are trained from the past 1.5 years to take care of their health by wearing a mask properly. And all these things have to be reinforced in a very proper fashion. And about the transport of children is also an important thing, where they have to be transported to schools. All possible mechanisms of protection have to be reinforced in that scenario. Third wave is still coming up, and the numbers are quite low right now, and we have to be taking care of all these things in the near future. And a lot of schools have opened in Punjab, Uttarakhand area, and Maharashtra and Andhra Pradesh, with good number of people going to the school. So in Telangana also, it is decided that 1st of September they would be opening schools, and extended period of non-school for the children is quite detrimental, and it's not good for their emotional and socializing capacity. So it is important that we go forward with safety, looking forward for the vaccine that is coming up for children in the next couple of months, couple of weeks. And then strategizing things in a proper way, the government and the private sector also, to make the load of COVID as low as possible by prevention. The prevention mechanisms have to be in place, the SOPs have to be in place, and strategies to help prevent COVID spread has to be in place, and they have to be implemented on a very regular method. Wherever students are at higher number of students are there, probably a shift system would work, or a batch system would work for them. But yes, you have to strategize things, and you have to strategize everything possible to make environment, children safe and child safe. Spread of spread of COVID has to be stopped, and the normalcy has to be established someday or the other. Keeping in mind that third wave numbers, if they increase, then you have to have another backup of remote learning techniques in place, which should be better than what have been had the last 1.5 year. So it is imperative, and it's a sign that life has to move on, and learning has to move on, and overall development of the children has to be taken care of.